my name is Sue McCarthy Robinson. I'm going to cover main structures, functions, and diseases of the eye. So as you see in the picture that's provided, the eyeball is not exactly a sphere, despite its appearance. There are two parts of the eye called the anterior segment and the posterior segment. The anterior segment consists of the cornea, lens, iris, while the cornea is transparent and curved part that also forms part of the posterior segment. It includes the anterior hyaloid membrane, the vitreous humor, the optic nerve, the retina, and the choroid. There is a circular pigmented area at the center of the eye called the iris. The black-looking structure is the pupil that controls how much light enters our eyes via the iris dilator and sphincter muscles. Light rays enter the eye through the cornea, pupil, and lens. The ciliary muscles control the shape of the lens during accommodation. Light rays hit the retina and are converted into electrical signals by light-sensitive cells called photoreceptor cones and rods. Electrical signals are then transmitted to the brain via the optic nerve, so it is interpreted as beautiful sight by our brains. A vitreous body is derived from the term vitreous, which means glasses-like in Latin. Between the lens and the retina, the vitreous body is a clear gel or a glass-like substance. The main function of this vitreous is to protect the eye. Most importantly, the fluid maintains the eyeball's spherical shape. The cornea is a transparent part of the eye that covers parts like the iris, pupil, and anterior chamber. It directs light into the eye. An outermost part of the eye is the cornea. The cornea's primary function is to focus and regulate the entry of the light rays. Cornea determines how much light enters the lens by bending or reflecting it. There are fibrovascular and pigmented epithelial layers in the iris. The iris is mainly responsible for determining the size and the diameter of the pupil. By regulating the pupil, it ultimately increases the number of light rays entering the retina. The iris also determines the color of our eyes. The pupil is a black hole in the center of the eye, and in the eyes it regulates the amount of light and then focuses it onto the retina. The aqueous humor is produced by the iliac muscle located above the lens. The ciliary muscle controls the accommodation of the objects at different distances. For focusing, the lens is reshaped by replacing or tightening the zonules. Zonules hold the lens in the eye that allows the lens to change shape for accommodation based on its location in the eye. The lens is a crystalline structure of the eye that's transparent in structure, which is found behind the iris and helps focus light on that retina. The lens changes shape to change the focal distance of the eye. The lenses focus light rays into the retina in order to form clear objects at any distance. The anterior chamber is an aqueous humor-filled space inside the eye, lying between the iris and the cornea's innermost layer called the endothelium. The conjunctiva forms the inner surface of the eyelids and covers the sclera. Its main function is to keep the front surface of the eye moist and lubricated, as well as the inner surface of the eyelids. When the eyes are lubricated, they are easier to open and close without friction or irritation. And they also protect from unwanted microbes from entering. It is a tough and dense white covering structure of the eyeball, which is the cornea. It is also called the white of the eye. It is a light-sensitive tissue lining. There's in the back of the eye, as the light rays enter the cornea, pupil, and lens, an image is formed at that retina. The retina's main function is to convert light rays into electrical impulses that travel straight to the brain via the optic nerve. The brain interprets a message and forms the image we see. A macula is part of the retina at the back of the eye. A cone cell is responsible for color vision, central vision, and sharp vision. There are more photoreceptor cells in the retina which help deduce light and send signals to the brain. The optic nerve is the second of the various cranial nerves that carry information from the sense organs to the brain. Its function is to connect the eye to the brain by carrying the impulses made by the retina, which are sent to the brain to interpret, and as we see in the image. And it helps us see the images that we're looking at. In addition to its beauty and magnificent structure, you can encounter numerous eye diseases as a person ages. For example, nearsightedness. You tend to not be able to see those far objects as clear as you once did. Or farsightedness. You're not able to see those close objects as you once did. Or a disease state called presbyopia, which is a hardening of your lens. But as you age even further, there's also macular degeneration, glaucoma, cataracts, diabetic retinopathy, or amongst several others. A third of the Americans over 65 have vision impairing eye conditions. Seniors are affected by, or the geriatric are affected by 4 major diseases: glaucoma, cataract, macular degeneration, and diabetic retinopathy. So you'll see on the second slide the glaucoma, have a picture here, and the result of glaucoma is an increased pressure that's inside the eye that causes damage to the optic nerve and results in vision loss and blindness. There's no obviously symptoms at first, but however, the person may notice their peripheral vision is gradually deteriorates as the disease progresses. And if left untreated, they may have worsening tunnel vision, is what they describe it as. So glaucoma is treated with many types of medications in a form of pills or eye drops. Some people, they can't, though that does not work, they have to have the pressure in their eye reduced by some surgery, laser surgery to be exact. So nurses educate their patients about safety, to assess their vision. If it's getting worse, to see their physician and due to safety reasons. And it's important to encourage compliance with those eye drops or the oral medications and follow-up care. So another one we're going to talk about is cataracts. It's a clouding of the normally transparent lens of the eye. When the protein clumps together in the lens, as you can see in this with this gentleman's eye, it can start to obstruct the transmission of light, and may be necessary to remove this cloudy lens and replace it with a new one if the cataract worsens and affects the vision severely. To prevent cataracts, nurses can educate their patients, if they're smokers, to quit smoking because it increases their risk for cataracts. Wear sunglasses outside to reduce the UV exposure, which can also increase the risk. It's common for people with cataracts to complain of a glare, cloudy, fuzzy vision, double vision in the eye, halos around lights, and only surgery can correct this vision loss. Another one, macular degeneration. As you can see here, the macula on the eye becomes damaged, so it impacts the central vision in a dramatic way. It reduces one's field of vision. Although it rarely results in complete blindness, many people suffer, struggle to read, drive, or any other daily tasks. The macula is the area, as I said, that becomes damaged, and it's responsible for the focus and central vision. So when that's depleted, it really becomes difficult for the person to see. So there's, in the early stages, no visible symptoms, but as it progresses, that central vision is what is actually impaired. So the blurry and the wavy vision that they'll describe. So the health of the retina is actually what kind of pays the price of this disease. And so peripheral vision is usually still intact, but the rest of that retina becomes damaged. Few treatments that can slow the progression is surgery, anti-angiogenic drug injections, and once again the nurse would need to educate to stay compliant, to gauge the disease state, and if the progression to seek medical attention for that. And another one, we're going to go on the diabetic retinopathy, potentially blinding disorder, which is a complication due to diabetes. Diabetes causes abnormal changes in the retina's blood vessels, causing them to become leaky and grow where they shouldn't. These vessels tend to break and bleed. As they try to heal, the damaged blood vessels will contract and detach the retina. Symptoms of diabetic retinopathy include shadows or dark objects that the person will see. They appear to floaters in their eye across the field of vision, blurred, distorted vision, partial loss of vision, and pain in the eye. This consistent high blood sugar and high blood pressure are associated with this disease state. There's no cure for it. However, laser treatment usually very effective for preventing vision loss due to the retina being severely damaged. Nurses need to educate their patients, again, once on the compliance of treatment, regular checkups, monitor, they know their own eyes, so to monitor their own progression for safety reasons. Thank you.